Thank you so much for that warm welcome and for being here. I know I'm the last session, so I appreciate you being here for me to be able to share with you a little bit about college student drinking. And I'm going to focus less specifically on prevention and treatment and more on sort of general social and biomedical issues that may come up in your practice, but I am going to leave you with a tool. My very last slide is how do you put what I am sharing with you today into practice? All right, so as requested, disclosure slide. I have nothing to disclose. I'm not going to talk about any commercial products. So we know that drinking doesn't start in college. In fact, it typically starts sometime between middle and high school for most individuals. But it certainly increases across that transition from high school to college. And it peaks in sort of that point at which it becomes legal to drink, around 21 or 22. And we see this pattern hold true for any drinking in the past year, for drinking in the past month, and for what we call binge drinking, which I apologize, my slides got a little squished. It's the green line is binge drinking, which for men is 5 drinks in a sitting, and for women is 4 drinks in a sitting. Oops. There we go. And there's several reasons why we see this increase across the transition from high school and all the way up until usually around senior year of college. Part of it is decreased monitoring. This is often a time where students will move away from home, will be living in the dorms. RAs, while they are there to monitor student behavior, they're not checking on them as frequently as parents would. There's less monitoring in terms of attendance in classes. High school teachers and principals will notice if a student is missing several days, but in a college classroom where you have several hundred students, you're not likely to actually miss if the person doesn't show up. This is also a time when we see self-selection into particular drinking environments. So freshman year is a high-risk period in and of itself. And I'm going to talk about why college is a unique environment for drinking-related risk. But people, once they get into college, may self-select into a fraternity or sorority, which is typically, but not always, associated with more drinking. Or they may self-select into an athletic team, be it one that's a professional athletic team or just a club sport. And we do tend to see higher rates of drinking among student athletes. They may just self-select into a group of friends that are heavier drinking friends that are going to then continue that behavior. There's also socialization into a drinking culture associated with college, and I'm going to come back to that point more extensively. But the other thing is there's increased stress. Number 1 and 2 things that come up when I talk to college students is stress and lack of sleep. And of course, those things are not independent. And alcohol impacts both of those in negative ways. In fact, alcohol decreases the quality of students' sleep, even though they think it helps them make them sleepy and they think it helps decrease their stress, but actually drinking to cope isn't an effective method. So there's several different things that we know that impact whether or not someone's going to develop difficulties with an addictive behavior. So there's obviously the biological contributions, which you would know better about than I would, those specific ones. I'm going to focus on the psychology and the sociology. So in terms of psychology, some of the things that I'm going to bring up today will relate to expectancies or beliefs about what students think alcohol is going to do for them. And we know that the more positive expectancies that students hold about what drinking is going to do, the more they drink. And then, of course, sociology, our culture. Culture is so influential. The speaker before was talking about how culture impacts how we as women communicate in the workplace. And the same is true with college students. They want to fit in. And college communicates certain norms about what's expected. It may surprise, some of you may not, that 25% of college students, on average, at any given campus, are not drinking at all. Most college students think, even the ones that don't drink, think every other college student drinks. They have this pervasive belief. And that social norm, that belief that more people are drinking than they are, actually also drives drinking. If you can correct that norm, you can decrease someone's drinking. So I'm hopeful that this is going to play. But coming back to that notion of culture and our expectations about what college is about and what's going to happen in terms of our drinking in college is communicated from a very young age. Now, for those of you who are familiar with South Park, this is not necessarily intended for young children, but certainly they do watch it. But we form our expectancies in early childhood. Whoops.
Children, I heard about what happened.
Oh, yeah, let's try that again. Huh. All right, I guess it's not going to play. I apologize for that. It started. It wanted to play.
Children,
oh, there
I
we
heard
go.
about what happened at school today. Now, none of you took that nasty marijuana, did you?
No, we never even saw it.
Okay, because I just want to tell you that drugs are bad.
We know, that's what everybody says.
Right, but do you know why they're bad?
Because they're an addictive solution to a greater problem causing disease of both body and mind with consequences far outweighing their supposed benefit.
And do you have any idea what that means?
No? Drugs are bad because if you do drugs, you're a hippie, and hippies suck.
Look, children, this is all I'm going to say about drugs. Stay away from them. There's a time and a place for everything, and it's called college.
Right? So Chef very succinctly summed up the cultural messages that we send. There's a time and a place for everything, and it's called college. And South Park is not alone in this, and you got to see my next slide. Certainly these are two very iconic representations of cultural messages we send about drinking. Animal House, which is older now, but is still very much present in the mind of college students. Old School is a little more recent, but certainly you can think of others. What are some movies that you can think of off the top of your head that show college student drinking and excessive drinking? I can't quite hear, sorry, yeah. 22 Jump Street. What else? Neighbors. That was one that I was thinking of putting up, a very recent example where the fraternity moves in next door to Seth Rogen and his family. So we can all think of these messages, and we get these messages, and they tell us not only that excessive drinking is expected, but also what it might do for us. And I have another video, I'm hoping it's going to play here.
My advice to you, start drinking heavily. Never listen to him. He's a pre-med.
So obviously I show that for your benefit. But we get this message that drinking is a solution. Drinking is going to help us. Drinking is going to make us feel better. These are all expectancies that we develop long before we take our first sip of alcohol for those of us that drink. There's other expectancies, and that they play into other behaviors, and they can also intersect with gender. Expectancies around sexual behavior, for example. It's going to make men often endorse, it's going to make me more confident, I'm going to be more suave, I'm going to be able to talk to people easier. These are all expectancies related to sexual behavior and social facilitation. So college, we know, communicates this is an environment where drinking happens, and research actually bears out that this is true. College students, and I apologize again, the rest of my key got cut off. Green bar is same age non-college peers. So you can see that lifetime it's relatively equal, but if you look at past year, college students edge out just a little bit. Past month, little bigger advantage over non-college peers. Daily is roughly equal, but binge drinking, that high-risk drinking, having a lot at once, college students routinely, year after year that we do these surveys, demonstrate higher rates of binge drinking than their non-college peers. And there's some reasons to explain that. One, if you're not in college, you're typically holding down a job, you can't be missing out on work, bad things are going to happen. It's a lot easier to miss out on class, things like that. So part of the environment facilitates that happening. But we also see higher rates of alcohol use disorder. It's not just higher rates of the behavior. So amongst college students, we see higher rates among both men and women in college versus their non-college age peers. And so these students are amongst the highest at need, and in fact, about 19% meet criteria in the past year for an alcohol use disorder. But of that 19%, one study found that only 3.9% used a service, got any kind of treatment for their alcohol use disorder. So about 4% of that 19% got treatment. Compared to their non-college peers, which was a little more than double, got services. So college students are the most in need, but the most underserviced in this particular arena. Not only that, but of the ones who did not seek any service for their alcohol use disorder, only roughly 2.5%, 2.4% saw a need. So they didn't perceive that anything was wrong that they would have to see somebody about. So the message to you is, if you are seeing college-age students, or college students specifically, ask about their alcohol use. You know, we typically ask about this. They maybe fill out a form in the waiting area, but take a moment and just really quickly, I just want to check in with you about your alcohol use. How much are you typically drinking in a week? So that you can have a conversation about it, because they may not see the problem. I also want to take a moment to point out that while typically in the past we've seen that men experience higher rates of alcohol use disorder and substance use disorder, especially in this age bracket, the gap is shrinking. So you may actually be more likely, implicitly more likely to ask your male patients than your female patients. So ask your female patients too. All right. So why do we ask? Why is it important to ask the question? Alcohol carries pervasive risk for harm. No amount of drinking is safe, only safer. So even if someone is drinking at low to moderate rates, they may still be experiencing some consequences from that. And the most severe consequences, so death, suicide, accidental injury, those happen very suddenly. So it's not liver cirrhosis that is killing college students. It's falling off of balconies and things like that when intoxicated, or getting behind the wheel of a car, or into the car with someone else who's been driving. But there are, of course, a lot of other harms. And I'm going to talk a little more in depth about particular harms that might impact female students more than male students. Excuse me. Such as sexual coercion, sexual assault. But there's also unintended pregnancy and STIs and other things that we need to have on our radar. So, women, as I said, are more likely to experience certain consequences than men. So on the more chronic end of the spectrum, women are more likely to have a rapid progression of liver disease due to their alcohol use. They're at increased risk relative to men for cardiac disease, even at moderate drinking levels. So again, that's why I say no level of drinking is safe, only safer. They're also at increased risk of breast cancer. And decreased brain volume has been found in imaging studies amongst women, which suggests greater sensitivity to alcohol's neurotoxicity. And I'm going to come back to how this might also play out in terms of cognition. We also see greater mortality among women who are drinking at the same level as men. So having 6 or more drinks a day was associated with an increased risk of death, 160% increased risk of death for women, compared to only a 40% increased risk of death for men, compared to light drinking. And actually, NIAAA, the National Institute on Alcohol Abuse and Alcoholism, has put forth guidelines of what they think is moderate or drinking that's less likely to negatively impact health, and they suggest for women no more than 1 drink a day, no more than 7 drinks a week. We also see in women, even in the college age, impaired reproductive health. So alcohol use can contribute to lower fertility for women who are trying to become pregnant, which is sometimes true for college students. But we most often see things like menstrual cycle disruption. So that might be a cue if you are seeing someone about menstrual cycle disruption to ask about their alcohol use. And of course, if a woman were to become pregnant and she's drinking, we see the effects of fetal alcohol syndrome on children. So I mentioned before, we see decreased brain volume in women compared to men who are drinking at the same level. And this suggests that greater sensitivity to neurotoxicity. And one way that this might play out, what we might see is we actually see greater cognitive impairment and motor impairment among women with regular drinking compared to men drinking the same amount. So women actually bear the brunt of the impact in terms of their cognition more than men. And they're actually also at greater risk for physical injury related to their alcohol use. The one that's most visible and prominent on college campuses today because of Title IX and because of recent incidents is greater risk for sexual assault and all that goes with it. So the psychological trauma of sexual assault, again, STI, unintended pregnancy, all of this that might go with that. And while it's important, and I want to still underscore that it's important to provide individual intervention to women to help increase their awareness and their safety, research suggests that there's environmental factors that may play a bigger role or the most significant role. And in fact, one study found that the overall level of binge drinking at a campus, so the rate at which the student body is engaging in binge drinking, was the strongest risk factor for a woman being raped while intoxicated. So this actually suggests we need environmental intervention as well. We need to do things at the campus level, not just at the level of speaking with individual students. I also want to raise the point that we, I think, have done a very good job of saying to female students in particular, watch who's making your drink, watch what they're putting potentially in your drink, never let your drink out of your sight. We're very conscious of that, but we sort of lose the forest for the trees by focusing just on that, because actually alcohol is the most common substance in a person's body when they experience sexual assault. Followed next by cannabis, which is now legal in Oregon, the state that I'm currently living in, and Washington, the state that I just left, as well as Colorado, and may be legalized elsewhere as time goes on. So students don't necessarily think about alcohol or cannabis as potential drugs that are used deliberately at times to facilitate sexual assault, to actually, someone is handing them a drink because they want to get them drunk so that they can take advantage of them physically. So we need to think about that in providing advice to our patients. So part of the problem with college students and saying, okay, well, let's talk about, what, if you were trying to be safer and make better decisions about alcohol, what might you do? Or even if we're just asking them, how much are you drinking? They may be like, I had one at a party. Well, their one and our one might mean very different things. And so we have guidelines for what a standard drink means, but students don't think in terms of standard drink. They think in terms of container, right? There's a slide I didn't include a picture of, but at one school, new regulations were imposed around tailgating. And they were told that you can have a drink at the tailgate, and so their solution was to get garbage cans, about yay big, and fill it with alcohol. So that was their one drink for the tailgating event. So in that case, they knew they were having more than one drink. But another relatively recent event happened in Washington where students were rushed to the hospital. They said, we think we've been roofied, we don't know what's going on, we only had one drink, what's happening, this can't be the alcohol. Well, it was. It was actually about 5 drinks in the one drink that they consumed, but they didn't realize. So this was not that one drink that I was just talking about, but this is another drink popular on college campuses and actually at the university I left, which also in its title connotes, again, that the sexual expectations related to alcohol, the pink panty dropper, right? So this is the recipe. It's available online. If you were to follow that recipe and fill up red Solo cups to almost full, it would make about 16 red Solo cups. How many standard drinks do you think are in each Solo cup? Huh? 3. Other guesses? More than that? So the Keystone Ice would be 17 standard drinks. The vodka would be another 51.2 standard drinks. And if we divide that across our 16 red Solo cups, we get about 4.26 standard drinks per cup. Right? And again, students tend to think of cup equals 1 drink, container equals 1 drink. So if they had only had 2 drinks, they'd be getting 8.5 drinks. So we also know that women, due to typically body composition of fat versus muscle, as well as decreased enzyme that breaks alcohol down, have some differences in terms of their blood alcohol level. So if you take a 160-pound man and a 120-pound woman, and both have one of those red Solo cups holding that pink patty dropper, which is about 4.26 standard drinks, the man would have a BAC of 0.066, so still underneath the legal limit. Although that is the level, 0.06 is where we start to see impaired judgment. So might be still feeling some of those effects. But the woman who's having a drink with him would have a BAC of 0.125. So that 1 cup in 2 hours, she's going to have double his BAC. At 0.125, we see very clear impaired judgment, motor control, nausea, things like that, much more severe effects. If they had 2 drinks over 3 hours, he would be now above the legal limit, but still less impaired than she's going to be. At 0.267, we would expect blackouts at that level, as well as nausea, things like that. When you get to 0.3, that's where there's the possibility of death in 1% of the population. So that might be something that you want to counsel your female patients on. If they come in and explain to you what they're having to drink, you can help them figure out how many drinks they actually are consuming and their relative risks. So the danger here comes, and this is the takeaway point I want you to have, the danger here comes when women match men drink for drink. And this is actually a very common, this is another social norm. If we were all standing around socializing somewhere, and whether it be coffee or alcohol, if I have a drink in my hand and you have a drink in your hand and I take a sip, what do you think you're going to do? Take a sip. It's called the Chameleon Effect in social psychology. We have a tendency to mimic the behavior of other people. That's one of the ways that we actually bond socially, is by mimicking each other's behaviors. It also fills that awkward pause at parties. If you're trying to get to know someone and you don't know what to say, take a sip, right? But if women are matching men drink for drink, it greatly increases their risk for negative consequences. One particular setting in which this happens is with drinking games. Drinking games, and that might be something else you want to ask your female patients about, place them at significantly higher risk, in particular for sexual assault. So this was one study that reported on the percentage of men who said this had happened in the past year. So about 17% endorsed that they had tried to get someone else drunk during a drinking games in the hopes of having sex with them later. So again, intentionally trying to get them drunk. 11% had said they tried to get someone drunk during a drinking game because the person didn't want to have sex with them earlier when they talked about it. 13% said they had taken advantage of someone after playing drinking games with them. And 9.2% said that after playing drinking games, they had had sex with someone that was too drunk to give consent. So again, women are significantly at greater risk for consequences because drinking games, both usually you're engaging in a lot of drinking, but also the more you drink, the more impacted they are relative to the other male players. And if a game has any kind of skill, like a lot of the games are set up to have motor eye coordination, like beer pong, things like that. you're going to play worse and you're going to be penalized more and have to drink more. Related to consent, I wanted to go back to the point I made about when I was talking about the man at a BAC of 0.066 that we see impaired judgment. We call this alcohol myopia. That as someone becomes intoxicated, their ability to process information within the environment gets narrowed to only the most salient things. So hence the myopia, short-sightedness. They only pay attention to what's right in front of their face, not literally, but like whatever is really key. So for some, that might be the bad mood that they have. Like say they failed a test, they might get more focused on that, and they might feel worse. For some, it might be an intention to hook up, right? The beer goggles phenomenon. Someone gets more attractive as the night goes on because you get focused on the intention and not on the other factors. But related to that is also potentially failure to use contraception, things like that. You're not focused on what are the long-term risks. You're focusing on what's happening in the short term. But that also, I think, relates to consent in that I think most students assume that someone's too drunk to give consent if they're really drunk, like if they're falling down drunk. But we know that judgment starts to go down at 0.06. So counseling students that actually you may not be getting consent even at moderate doses of alcohol, that it's not just when someone's falling down drunk. Now, obviously, sexual assault is a very severe outcome, and I would hope that these percentages would be 0. But you can see that for male students, 1.3%, and for female students, 2.5% in the largest study of college campuses across the United States in 2015. But far more commonly endorsed is unprotected sex. Again, why we want to ask about that and counsel about that. But doing something that you regret, which is also related to alcohol myopia. And if that's the hook for students, that they did something that ended up on Snapchat or Twitter or whatever that they're currently using, and they feel really badly about that, and that might be your in to helping that student change their behavior. So how do you do that? So I promised I'd leave you with a tool. You can use this acronym RULE to help you remember what to do in a brief advice session with a college student, and it relies on motivational interviewing principles. So we want to resist the writing reflex. If somebody tells us that they're having 2 pink panty droppers and we know how many drinks are in that, we don't want to say, stop, don't do what you're doing. Because the minute we tell someone what to do, what do? They push back. They do the opposite. They dig their heels in. So we want to resist that urge to write them. If the person says there's no problem, don't insist that there's a problem. Instead, we want to try and understand their motivations. We're usually better off if we ask them why they want to make a change and how they might do it, rather than telling them to change. And we do that by listening with empathy. We ask open-ended questions, and if we do want to share advice, if you want to share any of the information that I shared with you today, ask permission. It's really simple. It only takes 5 seconds to say, hey, I know something about this. Would you like to hear it? I've never, ever had a single person tell me no. Usually people are like, okay, why not, right? More info is better. Maybe I'm not going to do anything with it, but sure, I'll hear it. But that little step of asking for permission empowers the person, and it makes them feel like they're in control. Like what the other speaker said about the pace of the examination, or feeling like they can say stop. If you ask permission, then your patient's in the driver's seat. Then you share your information in a very factual manner, and then say, so what do you make of that? How do you think that applies to you? Again, let them tell you what conclusions they're drawing from that information. And then lastly, you want to empower the patient. It's one thing to know that you want to change, but it's an entirely separate thing to feel that you can, or to know how to do it. And it's really useless for someone to think, like walk you out of your office and say, oh, I know I should really decrease my drinking, but my friends are gonna resist, or I don't know how to say no. So we want to empower them, especially since most of them don't see a need for services. So I've been asked to wrap up. I'm just going to leave you with this, some questions that you can answer to help problem solve without actually telling the person how to solve the problem. And if you get the person to do the problem solving themselves, that's a very empowering thing. So I'm sorry I didn't leave enough time for questions, but I'm going to be around if you have any questions that you'd like to ask. Thank you.